Good morning, afternoon, and evening. I'm Yitong Yu, and I'm an undergraduate student at the University College London in the United Kingdom. I am honored to perform this presentation, which shares the same name as my paper, Verbal Memory Deficits in Schizophrenia. In this presentation, I'll follow the constructs of my paper. I'll first introduce schizophrenia and its general symptoms classification shortly, and then I'll talk a little bit about verbal memory deficits. Then the possible reasons for the deficits will be discussed based on my research, followed by recent treatments and interventions. I hope this presentation works well as an overview of my paper, so let's get started. Schizophrenia is a severe and enduring mental illness, first characterized as dementia praecox. The lifetime prevalence of schizophrenia is about 1%, and it is a threatening disease due to the high suicide rate and other deficits it brought. Schizophrenia is heritable. Among identical twins, the average concordance rate is 50%, and the genetic divergence suggests an concordance rate of 100%. It could be triggered by environmental factors like psychosocial stressors and biological factors such as complications during pregnancy and malnutrition. Apart from genetics and environment, the onset of schizophrenia is also associated with risk factors such as structural brain anomalies in, let's say, hippocampus and cerebral cortex. So, what symptoms exactly does schizophrenia cause? The academic field puts them into three categories: positive symptoms, negative symptoms, and cognitive impairment. Positive symptoms indicate something new, such as hallucinations and delusions. Negative symptoms indicate something lost, such as apathy and social withdrawal. And cognitive impairments include those involving intelligence and memory functions. Verbal memory deficits topic today belong to the third category, cognitive impairments. Verbal memory deficits represent one of the most prominent memory deficits in schizophrenia patients. Research has found that, though both being memory deficits, verbal memory is more likely to affect the families of patients compared to visual memory. This early manifesting deficit is, therefore, a hallmark symptom of schizophrenia. The academic research community has developed methods to assess the verbal memory deficits in schizophrenia. Verbal recall serves as a fundamental measure to assess these abilities, with impaired free recall indicating an inability to access stored information. The most widely adopted method for assessing deficits involves administering a series of wordless learning tasks, such as re-auditory verbal learning task and the California verbal learning task, which yields immediate and delayed recall test scores. What has possibly caused these deficits then? Well, let's discuss it in three aspects. There are still some controversies when it comes to the potential learning effects of participating in verbal recall tasks repeatedly, but it's clear enough that the brain is activated differently in schizophrenia patients during the tasks. fMRI studies have identified the common clusters in frontal and temporal brain regions associated with superior recall performances. Notably, an underactivation in the ventrolateral prefrontal cortex has been observed in individuals with schizophrenia, potentially contributing to their verbal learning deficits. As it is memory-related, studies explore the hippocampus role in memory deficit schizophrenia too. No significant or differences in recall between patients and controls were found. However, schizophrenia patients show stronger task-related responses in the right anterior hippocampus and reduced activity in the left posterior region, without direct correlation to recall performance. A consistent negative relationship between hippocampal volume and verbal recall performance was noted, with reduced volume contributing to both immediate and delayed verbal learning deficits. Additionally, significant gray matter loss in frontal, temporal, and parietal areas was observed in schizophrenia patients compared to others. Among patients, abnormal responses in the brain's inferior frontal gyrus, particularly in bilateral ventrolateral regions and right side, was noted. These patients show underactivation in key brain areas during verbal learning tasks, with diminished responses in parietal and frontal clusters compared to healthy controls. The study also observed unusual brain radiation patterns in schizophrenia patients with elevated levels of alpha, beta, gamma, and theta frequency bands. These findings suggest that an increased cortical noise from high-frequency radiation may contribute to verbal learning deficits in schizophrenia. Given the sophisticated nature of cognition and brain systems involved, there is currently no optimal medication available for addressing cognitive and negative symptoms. What's worse, some of the primary treatments for schizophrenia, which target positive symptoms, may worsen cognitive deficits. Medications could be applied together to achieve optimal effects on both positive symptoms and cognitive impairments. For example, we have aripiprazole, a serotonin dopamine system stabilizer known to alleviate affective and cognitive impairments. Complementary medications with minimal cognitive side effects may also be incorporated as needed. Other interventions could be developed from the research finding of the causes of verbal memory deficits. I won't talk too much about this here due to the time limits, but it is clear enough that hippocampal volume is fairly crucial. Brain response and activity-targeted treatments could be helpful too, and in the paper, a technique called repetitive transcranial magnetic stimulation, which has been applied to Alzheimer's patients, is mentioned and worth further research. We need more research. Schizophrenia, due to its limited range of onset in species, has been challenging to study in animal models, leading to a lack of experiments that can be conducted solely on animals such as rats and mice. Since linguistic functional disorders in humans cannot be effectively replicated in animals, there is a pressing need to develop animal models specifically designed for verbal memory research. Given their highly genetic similarity to humans, primates may offer the most promising possibility for developing such models. Thank you for listening. I hope you enjoyed, and please feel free to contact me if there is anything I didn't explain clearly enough.